Good morning. So today we are going to be going over 5 different types of injections: intradermal, sub-Q, and intramuscular. Now, the first thing that we always want to do is we want to have our 6 rights correct. So that's going to be the right patient, the right drug, right dose, right time, right route, and right documentation afterwards and before. And we're also going to be very, very vigilant on our hand hygiene. So, let's begin. In this video, we are going to do subcutaneous insulin injection. Now, first thing we want to do is go and check our order and also check that with the MAR to make sure that we're giving the right medication to the right patient, the right dose, the right route, right documentation, right time. We're checking our 6 rights again, because medication errors can be avoided if you take these extra steps in ensuring that you're giving the right medication to the right person. So I'm gonna look at my order. So it looks like Dr. Jumpy wrote for Humulin NPH 100, insulin 16 units sub-Q, and then also Mr. Rocker is on a sliding scale for Humulin R. Looks like his blood glucose at 7 o'clock this morning was 248. So based on the sliding scale, we're going to give him 10 units of that one. So that's going to give us a total of 26 units of insulin total that we're going to give this patient sub-Q this morning. Now that I've checked my MAR and compared it to my order, now I'm going to get my right supplies that I'm going to need for the subcutaneous injection. So since this patient has 2 types of insulin, I'm going to get the 2 types of insulin syringe, alcohol wipes, and rubber gloves. Now that we have our vials of insulin, we're going to take them, and we don't ever want to shake these. So to mix them, we're just going to put them in between our hands and just roll them back and forth. Nice and easy. You can also do just like turning it up and down too. You just don't want to shake it violently. Then we're going to do the same thing with this one. And you're going to do that for about a minute on each one, because a lot of times these are kept in the fridge and you want to warm them up. We're also going to want to check the date and time. If this is a multi-use one, we're going to see if it is marked for the last person that used it and the time that it needs to be discarded. If it's a single use, then there's not going to be any sort of initials on it, because it should be thrown away if it's a single use vial. But so we're going to look at these. We're going to look at make sure the medication is correct on each of them, and then we're also going to check, since this one is going to be a multi-use, we're going to put our initials on it, the date and time, and then also the date that you're going to want to discard it, which is 30 days later. Okay. Now that we've gotten that done, these were capped at one point, but we're going to use an alcohol swab and clean the tops of them. Okay, now those are clean. So now we have our insulin syringe. We're going to push the plunger in and out a couple of times, make sure we get all that air out of the needle. Then we're going to draw back our combined dose of 26. And we want to make sure that we always go clear to cloudy when we're doing insulin. So in this case, we're going to do the Humulin R and then the Humulin NHP or MPH. So, but what we want to do is we're going to want to inject our 16 units of air into the Humulin NPH, and that way then we can inject the remaining 10 into our short-acting then we can start drawing up our medication, okay? So we're gonna go being really careful with the needle to not poke ourselves or poke anybody else. So the first thing we're gonna do is we're gonna put it into the NPH, and we're gonna inject without putting the needle into the medication at all. We're gonna inject our 16 cc's of air. Then we'll pull it out. And then we're gonna, we wanna remember to keep the bevel up on the needle when we're placing it in. We're gonna start at the 45-degree angle, and as soon as we get in, go straight up to the 90. Okay, so now we're gonna inject that 10 cc's of air into the vial, okay? And we're gonna flip it over, and we're gonna draw back. On this one, we can draw back more than the 10. We can draw back too much, and then I like to push it back in so we can make sure we get all those air bubbles out. And we're gonna draw back. Sometimes you gotta flick it to get an air bubble out. Okay, so now we have our 10. Okay, now this time being really careful again, keeping the bevel up. And go up to the 90 again. Now, this one we have to make sure and draw back exactly what we need. Because if we go to 28, we need to just throw the entire syringe away and start over again. So we're gonna be really careful when we're pulling this one back, and we're gonna get to that 26. Okay, now I'm going to carefully recap this in the safe technique that we learned by scooping and then not pressing from the top, because we want to keep our hands away from the needle tip as much as possible. Now let's click back on there. So we also want we're always going to get insulin co-signed by another nurse, okay? So normally I would have someone come and verify what I drew up based on the order that was shown on the MAR, and then they'll sign it off, and then we'll be able to give the injection. Now that we've drawn up our medication, it's time to go ahead and go on down to Mr. Rocker's room, and let's give him this insulin injection subcutaneously. So you wanna come with me? Come on, let's go. You coming? Come on. Mr. Rocker, how are you today, Skip? Hey, Skip, can you tell me your last name and date of birth, please?
Hi there, Steer Bear. Skip Rocker, 1172.
Thank you, Skip. Now, I got to give you your insulin this morning, so we're going to be giving you those two forms, the short-acting and the intermediate. It's going to be a total of 26 units. I'm sure that's what you got yesterday too, correct? Yeah. So, you have any questions for me right now? I'm going to do this in your abdomen. You okay with that? Okay. Let me wash my hands. Okay. All right. Put my gloves on. Skip, how'd you sleep last night? You have a good night?
It was all right.
Yeah? You got some sleep though?
Yes, sir.
Okay. So, all right, Skip. So, while you're laying in bed, I'm going to clean the spot that I'm going to do your injection in, okay? Okay. Skip, you got any questions for me right now before we get started?
I don't know why you're saying this. I get insulin every day.
Well, Skip, I'm just making sure that we do things in the correct order and safely, okay?
Alright.
Now that that's all dry, we're going to hold the syringe in our dominant hand, bevel up again, and depending on what size your patient is, if it's a larger patient, you're going to go into the 90-degree angle with the needle. When you're having a thinner patient, you're going to want to go up more of a 45-degree angle, okay? Because you don't want to go too deep with this. This is subcutaneous. This is not any other type of injection, so we don't want to get into those deeper spaces, okay? So since Skip is quite thin, he's only 185 pounds, we're going to go in at a 45-degree angle on him, okay? So now that I've cleaned my area, I am ready to inject his insulin. And we're going to want to go, slow. We don't want to just slam it in there as quickly as we can. Nice and slow and steady with this one, okay? So with my non-dominant hand, I'm going to squeeze and at a 45-degree angle. And then I'm just going to slowly administer this in. And then we're going to pull it straight out. And we'll dab it with a piece of gauze if there's any blood. And then we're going to, once this has gone into a patient, we're never, ever, ever going to cap it again unless there would have to be like some crazy emergency that all of the sharps containers just ended up on the far end of the hospital from you. How that happened, I don't know, but if you had to absolutely do it because there was an emergency or something like that, we would want to do the one-handed scoop technique again, but for general purposes, we don't cap a needle again after it's gone into a patient, okay? So I'm going to put that into a sharps container, and now I'm going to go and I'm going to document that I gave Skip the insulin and go through my whole 6 rights again and document all of that, and then this one's done. Thank you.